I'm Dr. Rebecca Bradley, and first off, I just want to congratulate you on your pregnancy, whether this is your first pregnancy or you have had babies before. Obviously, this is a really exciting time and a time where you may have a lot of questions. And so we wanted to make a little video prior to your first appointment that you could watch that may give you a little bit of information regarding the doctors in the practice and Physicians for Women as an OBGYN clinic, as well as what you might expect when you come in for your first appointment or for your prenatal care appointments in general. So I'm Dr. Rebecca Bradley, but I am only one of 3 physicians here at Physicians for Women. We have Dr. Verhade and Dr. Colgrove, who are also fantastic OBGYNs, and I am very lucky to be able to be working with them. For your first appointment or for your prenatal care, you are more than welcome to choose any one of us, or you can have the front desk choose the next available appointment for you, and that will be with any one of us. So if you think that you might be pregnant or you've taken a home pregnancy test, the first thing that you should do is come in and confirm that pregnancy with us. Our staff will do a urine pregnancy test at that time. They'll take some information down that may give you a relative due date. That's obviously not confirmed. Once we do your first ultrasound, your due date will be confirmed with your doctor. And we generally will schedule that first ultrasound around six to 9 weeks, depending on where you're at in the pregnancy. And that first ultrasound will give you an exact due date, and then you'll see whichever physician you either chose or have been scheduled with. So at your first appointment, we will do an ultrasound to confirm your dating. We'll also do a full history and physical. The physical will include a breast exam, a pelvic exam, and you will have already been able to see generally the heartbeat with the ultrasound that day. And we'll go over with you what to expect in the coming months and in the coming appointments. Generally in the first part of the pregnancy, we'll see you every 4 weeks unless there's a problem, and you are always welcome to call the clinic. And if you have a question that we can answer over the phone, we can answer that over the phone. Or if you feel like you want to come in earlier than your appointment, you are more than welcome to make an appointment, and we can figure out anything that might be troubling you or anything that you're feeling. We can try and take care of at that time. After your first appointment, we'll go through what you can expect in the pregnancy moving forward. And you may at any point in the pregnancy see another one of the doctors here in the clinic just to get you familiar with each one of us, so that when you come to labor and delivery, whether you're having an issue or you're in labor and it's a different physician that's on call that day, you will know all of us and be familiar and comfortable with everyone here in the clinic. At your 16-week appointment, that will be an important appointment to do some labs, as well as at your 18 to 22-week appointment will be when we get to do the anatomy ultrasound, where we look at all of the organs and all of the hands and the toes, and you'll get to find out the gender.
Hi, my name is Dr. Verhade. I'm one of the physicians here at Physicians for Women. So we're going to kind of talk about what goes on in the 2nd and 3rd trimesters when you come see us. So at 28 weeks, we check for your test called the glucola. This looks at if you have developed diabetes in the pregnancy. This can happen for a lot of different reasons. Pregnancy itself sometimes changes how our bodies modulate insulin. But basically, people will tell you about this test sometimes because you have to drink a big cup of something that's supposed to be very sugary, but doesn't always taste so good. But we have you do that on a fasting basis at that visit. And we also check to see if you have any anemia and may need a little bit of iron to supplement your levels in pregnancy. The next big test that we do in pregnancy is at 36 weeks, where we check for something called group beta strep. This is a bacteria that many women have, and it's not anything bad or good, but we check because if the baby goes through the birth canal and there's this particular type of bacteria, sometimes it can cause baby to get a little bit sick. So during the labor process, if you have it, we give you antibiotics to protect baby. It does require a vaginal exam, and it's a little Q-tip, so nothing too uncomfortable, but a very important test for the delivery process. After that, we start seeing you on our frequent flyer program every week after that until you deliver. And we look forward to seeing you on a more regular basis. At that point, you'll be feeling much more fetal movement. You may even feel some occasional contractions, but everything, we check and make sure everything is going well at all of those visits. And if there's ever any questions or concerns, there's always a doctor on call 24/7 that you can reach out to. So important signs of labor that we ask you to check for as you get towards the end of pregnancy. One is contraction, so make sure if you're feeling a tightening in a regular fashion every 3 to 5 minutes for more than an hour or two, probably a sign that your body's starting the process, and we would have you follow up with us on labor and delivery to check and watch your contraction pattern and see if you're dilated. Another important sign is if there's any heavy vaginal bleeding. Sometimes that can happen as you progress and your cervix opens up for labor. Another important sign is if you have a big gush of fluid like a water balloon broke and you kind of still have trickling after that, that can be a sign that your water has broken and we need to evaluate you and start the labor process. Sometimes towards the end of pregnancy, you may have increased episodes of having a little bit of pee on yourself, and that happens and that's normal. But if it kind of continues and is a lot, that might be a sign that your water bag broke. And finally, the most important thing that you can keep track of all the time at home as well is making sure baby's moving on the inside. So as you get to full term, baby will move much more consistently. Baby may even have a schedule, more at night, more in the morning. But if there's any big changes in that movement, you should come in right away and let us know. Sometimes we have to make sure that you're eating and drinking normally because that's how baby gets energy. But if you've been eating and drinking and baby's still not doing its normal stuff, then you should come see us on labor delivery.